Imagine getting sick in the Middle Ages. No antibiotics, no painkillers, no x-rays or blood tests. Just a physician who believes your illness is caused by an imbalance of bodily fluids and thinks the best treatment is to drain a significant amount of your blood with leeches. Sounds terrifying, right? But here's what might surprise you. Medieval medicine wasn't just random superstition and torture. It was actually a sophisticated, rational system based on theories that had survived for over 2,000 years. Yes, it was often wrong. Yes, some treatments were harmful. But medieval people were using genuine herbal medicines, performing successful surgeries, and developing medical education systems that would eventually evolve into modern medicine. Today, we're diving into how medieval people actually treated illness, and the truth is far more complex and fascinating than you might think. Let's start with the foundation of everything. Medieval medicine rested on a comprehensive theoretical framework inherited from ancient Greek physicians, particularly Hippocrates and Galen. This framework was the four humors system. The four humors, or bodily fluids, were blood, yellow bile, black bile, and phlegm. They were thought to combine four qualities: hot, cold, dry, and moist. And these qualities were believed to affect temperament, physical traits, and health. Each humor had specific properties. Blood was hot and moist, associated with air and spring. Yellow bile was hot and dry, associated with fire and summer. Black bile was cold and dry, associated with earth and autumn. Phlegm was cold and moist, associated with water and winter. Based on Hippocratic medicine, physicians believed that for a body to be healthy, the four humors should be balanced in both amount and strength. Health consisted in humoral equilibrium. Illness resulted when an excess or a deficiency occurred in one or more of the humors. This was not just a physical theory. It also encompassed personality, psychology, and every aspect of human experience. The body was a system of four fluid humors. If the humors were in balance, the body was in health. If the humors were out of balance, the person was sick. Medieval physicians saw the human body as a microcosm of the universe. In its tidy arrangement of naturally balanced humors, the body reflected the larger world, whose equilibrium depended on four elements: earth, air, fire, and water. This holistic view meant that the positions of the moon and planets were considered important when making a diagnosis and deciding on a course of treatment. How long did this system last? The notion that four bodily fluids caused illness persisted for more than 2,000 years in the West, until the rise of controlled empirical science in the mid-19th century. Galen was the most influential ancient physician during the Middle Ages, and he held undisputed authority over medicine throughout the entire period. So how did medieval physicians actually diagnose illness? Physicians were trained in the art of diagnosis. Observation, palpation, feeling the pulse, and urine examination were the primary tools of the doctor throughout the Middle Ages. On first visiting patients, doctors noted their appearance, listened to their stories, felt their pulses, and examined their urine. Urine inspection was the most common method of diagnosis, and the urine flask became the symbol of the doctor. By 900 AD, Isaac Judaeus, a Jewish physician and philosopher, had devised guidelines for using urine as a diagnostic aid. Physicians examined urine for color, consistency, clarity, and sediment. Medieval medicine was remarkably personalized. Physicians used the theory of the humors to explain every complaint, medical or psychological. A physician's course of treatment had to be tailored to the individual patient, or at least to their age group and gender. Now let's talk about herbal medicine, because this is where medieval medicine actually had some genuine successes. The use of herbs drew upon the medieval Christian doctrine of signatures, which stated that God had provided some form of alleviation for every ill, and that these things carried a mark, or a signature upon them, that gave an indication of their usefulness. In the Middle Ages, the study of medicinal plants was in the hands of monks who, in their monasteries, planted and experimented on the species described in classic texts. No monastic garden would have been complete without medicinal plants. Monasteries became centers of botanical knowledge. Inside most monastery grounds, there was a separate garden designated for the plants needed for the treatment of the sick. There are herbs known today such as sage, rosemary, thyme, bay, and mint, as well as common perennial plants. Sage, whose name comes from the Latin salveo, meaning I am well, was used by the Romans in medicine and cooking. Many of these herbs had genuine medicinal properties that modern science has confirmed, even if medieval understanding of why they worked was based on humoral theory rather than biochemistry. Ingredients were often mixed with common products such as ale, white wine, vinegar, milk, or honey. Medieval physicians also exploited international trade networks using cumin, pepper, ginger, and other spices in their formulations. The recipes were practical and straightforward, typically comprising a short series of simple instructions, much like a modern-day prescription or cookery book. One of the most remarkable medieval herbalists was Hildegard of Bingen, who lived from 1098 to 1179. At a time when formal medical education was largely closed to women, Hildegard wrote Physica, an extensive compendium of the natural world's healing properties, and Causes et Cure, a medical textbook on causes and cures of diseases. Now we come to the treatment that medieval medicine is most famous for: bloodletting. Physicians in the Middle Ages believed that most human illnesses were the result of excess fluid in the body, called humor. The cure was removing that excess fluid by taking large amounts of blood from the body. If excess blood caused illness, the logical treatment was to remove it. There were two main methods of bloodletting. In leeching, the physician attached a leech, a blood-sucking worm, to the patient, usually on the part of the body most severely affected. The leech would feed and then fall off. The second method was venesection, in which physicians used sharp blades called lancets or multi-bladed instruments called phlemes to cut veins and drain blood. Bloodletting was incredibly widespread. Monks in various monasteries received regular bloodletting treatments, whether they were sick or not. As a means of maintaining good health, they were excused from regular duties for several days while they recovered. This reveals how deeply bloodletting was embedded in medieval health practices. It was preventive, as well as curative. Surgery occupied a peculiar position in medieval medicine. Surgeons in the early part of the Middle Ages were often monks because they had access to the best medical literature. But in 1215, the Pope ordered that monks stop practicing surgery, and the work passed to lay practitioners, including peasants. This led to the rise of barber surgeons. They were expected not only to perform formal surgery, but also to be skilled at cutting hair and trimming beards. Common procedures included bloodletting, amputation to remove infected limbs or battlefield injuries, tooth extraction to alleviate dental pain, and cauterization to stop bleeding by burning the wound. War drove significant surgical innovation. Medieval battlefield surgeons had the practice of amputation down to an art. Typically, it would have taken less than a minute for a surgeon to remove the damaged limb, and another 3 to 4 minutes to stop the bleeding. The procedure was systematic. The surgeon would first place the limb on a block of wood and tie ligatures above and below the site of surgery. Then the soft tissue would be cut through, exposing the bone, which was then sawed through. The stump was bandaged and left to heal. The rates of mortality among amputation patients were around 39%. That number rose to roughly 62% for patients who received a high leg amputation. After amputation, the common procedure was to cauterize the open end to stop the hemorrhaging. Healers heated oil, water, or metal and touched it to the wound to seal off blood vessels. To prevent infection, they cleaned wounds with vinegar or wine. This practice was effective. Wine and vinegar have genuine antibacterial properties because of their acidity and alcohol content. Even though medieval practitioners did not understand germ theory, medieval recipe books reveal some startling ingredients. One treatment for gout involved stuffing a puppy with snails and sage and roasting the animal over a fire. The rendered fat was then used to make a salve. To treat cataracts, described as a web in the eye, one recipe recommends taking the gallbladder of a hare and some honey, mixing them together, and applying the mixture to the eye with a feather for 3 nights. Medieval surgery was incredibly painful. Without modern anesthesia, patients endured procedures in excruciating pain. Surgeons had a limited understanding of human anatomy, anesthetics, and antiseptic techniques. Practitioners did attempt to manage pain. Herbal mixtures, alcohol, and even opiates were used to dull pain during amputations. The interweaving of medicine and religion was striking in the medieval period. God was considered the divine physician who sent illness or healing according to his will. From a Christian perspective, disease could be seen either as a punishment from God or as an affliction caused by demons. However, this did not mean medicine was abandoned. Medical practitioners cited the Bible and Christian history as evidence that humans could and should attempt to cure diseases. Many monastic orders, particularly the Benedictines, were deeply involved in healing and caring for the sick and the dying. Monks stayed with patients throughout the day and night, praying and reading from the scriptures by candlelight. Many monks sometimes gave their own lives when treating the sick, demonstrating genuine dedication to healing work. There was a whole hierarchy of medical practitioners in medieval society. By the 12th century, there were medical schools throughout Europe. The most famous was the school of Salerno in southern Italy. These university-trained physicians were rare and expensive. Most people in medieval times never saw a doctor. They were treated by the local wise woman, who was skilled in the use of herbs, or by the priest or the barber. In a village, the wise woman or man often had knowledge passed on from the generations before and many years of experience working with herbs. Often, the wise woman delivered babies too, and her skills were highly valued. Childbirth in the Middle Ages was considered so deadly that the church told pregnant women to prepare their shrouds and confess their sins in case of death. During the Crusades, many people traveled to the Middle East and learned about scientific medicine from Arabic texts. In the Islamic world, Avicenna was writing the Canon of Medicine. This included details on Greek, Indian, and Muslim medicine. Scholars translated it, and in time it became essential reading throughout Western European centers of learning. Avicenna's canon detailed 760 medicinal plants and how to prepare remedies from them. So, what actually worked in medieval medicine? Many medieval herbal treatments had genuine medicinal properties. Willow bark contained salicylic acid, the precursor to aspirin. Cloves contained eugenol, which has antiseptic properties. Sage had antimicrobial properties. Honey had antibacterial properties. Vinegar and wine acted as antiseptics. Some medieval surgeons challenged established practice and developed better methods. Treatments were generally conservative, tending toward advice on diet, exercise, or bathing. Many medieval treatments focused on lifestyle modification, including rest, appropriate diet, and moderate exercise, which remains sound medical advice today. What didn't work? While based on logical theory, bloodletting often weakened patients. Cautery was believed to prevent infection, but modern research shows that cautery often increased the risk of infection by causing more tissue damage. Medieval medicine had no effective treatments for epidemic diseases like the Black Death, which killed millions. Medieval people treated illness through a sophisticated theoretical system that, while scientifically incorrect in its fundamentals, represented a rational attempt to understand and treat disease. The humoral system provided a comprehensive framework for diagnosis and treatment that persisted for over 2,000 years, precisely because it offered satisfying explanations and sometimes achieved positive results. Medieval medicine accomplished several important things. It established systematic diagnosis through observation and examination. It developed an extensive pharmacopoeia with hundreds of herbal remedies, many with genuine therapeutic properties. It advanced surgical techniques, including successful amputations and wound treatment. It created medical education through universities and teaching hospitals. It maintained Greek and Roman knowledge through Islamic intermediaries and monastic scholarship. What medieval medicine lacked was germ theory, effective anesthesia, antiseptic technique, accurate anatomy, the scientific method, and effective treatments for epidemics. Medieval medicine was neither the miracle-working system portrayed in some romantic histories, nor the superstitious quackery depicted in popular stereotypes. It was a complex, evolving system that combined inherited classical knowledge, religious faith, practical experience, and careful observation to treat illness as best contemporary understanding allowed.